introduce myself. My name is Dr. Jim Gude, and I'm a intensivist. That means I run an intensive care unit. A pulmonologist, I do chest consultations, and an internist, I do internal medicine. And I'm an older physician. I'm also a clinical professor at the University of California, San Francisco. So I've grown up with teaching nurses, residents, fellows, and so forth. And I'm glad to be alive and kicking right now because informatics has made medicine better. When a physician sees a patient, he relies upon three items to really make a diagnosis. One is the history, and that's actually 80% of what you do. And then the physical examination, 10%, and the laboratory data, 10%. And knowing the history is so important. Knowing a patient got a tetanus shot in the past, or knowing that they've got an influenza vaccine, or knowing they had a heart attack a couple years ago, or knowing that they smoke and they stopped smoking 10 years ago, whatever. Everybody has a history. And like Sherlock Holmes, the more clues you have, the better you can make a conclusion, a diagnosis. And informatics enables the physician nowadays to have a real repertoire of information. I'll give you an example. Let's talk about an electronic medical record. I'm asked to come see a patient. I can either see the patient in person or I can see the patient virtually. The one is traditional in person, I'm in my boots. The other is by telemedicine over the air, if you will. The first thing I do when I come in is to learn as much as I can about that individual before I talk to them, so that I have a background on them, almost an archives. And what I'll do is I'll go to the electronic medical record and look at the most recent discharge from a hospital or the most recent history and physical by a physician or consultant, and I'll read that over. I then can scan things such as allergies, social habits, smoking, drinking, use of recreational drugs, family history, what did the father, mother do have, are they surviving, occupation, habits, you can actually, what type of music a person likes, they exercise, what books they read. This is all in a good history and physical taken by someone who pays attention to detail. So by scanning what's available in the electronic medical record or on paper, now which is faster, do you think? By looking at electronic medical record, I can scan very quickly. By paper, I have to go through volumes, find the volume, finger the right section, and get the history of that date, the physical exam of that date, the laboratory of that date. So in summary, a physician is really as good as the data that you have. And it always surprised me how important the history is over everything else. That a person will tell you something that gives you a hint of what's going on. And then you can use that as an exploration to go ahead and make a diagnosis. It opens a portal, if you will, towards the diagnosis. So in informatics, I'm joyful that I have more data because I know when I see a patient who is mute and has no history, I'm practicing veterinary medicine. I have nothing to go on except my physical exam and some lab values, which is about 20% of what I need. I need that other 80%. So informatics is a joy to medicine. It enables you to tap a lot of information, and the way it's presented is you can very easily scan a record and see what's abnormal. You don't have to look at normals. You can see this patient had a uric acid of 15. Now they come in with a swollen great toe, podagra, and you can say that's gout very, very quickly. Or let's say the uric acid was normal, and that swollen great toe has, in addition to redness and swelling, bulli that are filled full of fluid. You know that's an infection. That really is an infection with septic arthritis. But knowing that lab data helps me so much in terms of leading me in the right direction and preventing me from going in false directions. So the three things that are very important for making that diagnosis, that are the most important: informatics, informatics, and informatics. And I can't emphasize enough the data.